very happy to have an opportunity for us to get an update from our public health partners. As a reminder, this is being recorded. You'll be able to find this information on the website, Rethinking Schools website, within about 24 hours. And this will be available also in Spanish. I'm going to ask Marta Baton now to provide information for those that are interested in live Spanish translation.
Thank you, Mary Jane. Buenas tardes, yo soy Mary Jane Burke y estoy muy feliz de tenerlos nuevamente aquí junto al personal de salud pública. Voy a dar esta grabación, va a estar disponible dentro de las 24 horas en nuestro sitio de internet y ahora voy a dar las instrucciones para que ustedes puedan escuchar esta transmisión en español simultáneamente. Thank you, Mary Jane.
Great, thank you, Marta, very, very much. So for all of you to know, we're entering the 48th week since we first went into shelter in place, which was March 16th, as a reminder. This represents about the 24th time that our public health partners have been available to our community to update us and provide information to help us continue to keep our community safe and have the most up-to-date information related to public health and how we can reopen our schools for in-person opportunities safely over the long haul. You'll be excited today. You're going to see an updated slide that will show you that we are now close to 1 million in-student days. 72% of school staff, public, private, independent, and parochial, are now working with students in person. So we have much to be proud of, and it wouldn't happen without this entire community rowing in the same direction. So at this point, I'd like to pass the microphone over to Dr. Willis.
Thank you, Mary Jane. Great to see everybody. Thanks for that reflection on the amount of time it's 48 weeks, 24 of these conversations. We've been in this together from the start. And I just want to start by acknowledging the collaboration that this has represented between public health, MCOA, all of our school districts, parents, teachers. It's really been a remarkable success of our pandemic response. Just the conversations themselves, setting the table for this dialogue so that we can navigate, I think, what have been some of the most challenging decisions that have faced us in this pandemic. For our part in public health, we are part of the Department of Health and Human Services, and this is our mission that we have tried to stay true to throughout this, which is to promote and protect the health, well-being, self-sufficiency, and safety for all in Marin. And we take that all, a little word with a big idea, very seriously. This is also how we've grounded ourselves. We obviously, when times are hard and there's complex decisions to be made, just regrounding ourselves in our principles is so vital. And this is a principle that we've been applying around health. Health being a state of complete physical, mental, and social well-being, and not merely the absence of disease and infirmity. And that's been particularly important as an organizer for us in our COVID-19 response, because we have an infectious disease that has communicable disease characteristics, which on the surface may be easier to control by just asking everyone to stay home would be the most simple strategy, because it's communicable disease, and knowing that obviously there's a continuum of risk that we're balancing harms from isolation to togetherness, to social, the consequences, economic consequences of business closures, et cetera, and really acknowledging that schools represent so much in terms of mental and social well-being in that definition of health. Next, please. And then I just came across this quote that I found really helpful, and I hope that others do. This is Frodo speaking at the end of the Fellowship of the Ring to Gandalf. And he says, "I wish it need not have happened in my time." And Gandalf says, "So do I. So do all of us who live to see such times. But that is not for them to decide. All we have to decide is what to do with the time that is given us." And I just want to again say the time that has been given us over the past year in Marin County to reconcile the needs around safety, around the pandemic we're experiencing, with the well-being of our students and our school communities has been well spent. We have spent that time working together very closely, and I think we can be proud that we have navigated this successfully by and large. And we will continue to work on this. Our work is far from done, but I think we've set the stage to continue a positive response. Next, please. So here's our I'll just end my part with just a quick review of where we are in the pandemic. This is our 3 curves. You can see that one on the far left, very small, which is when we first started the shelter in place. One of the first counties to close schools, put that shelter in place policy. A lot we were learning about the virus and the relationship to school communities at that time. Then we had our larger spike in July, primarily our Latinx residents, 80% of our cases in that July peak. And then more recently, starting around Halloween, increase, obviously, that was superseded any of the others. And that was really characterized by both our essential workers, Latinx residents, as well as every community in Marin really pulled into the experience of the pandemic in that latest curve. What's really interesting and important about this is that there has been a remarkable drop. In fact, the largest sort of change of any kind, upwards or downwards, has been just over the past few weeks in declining cases. Our case rates now are less than half of what they were just a few weeks ago, which is really encouraging. So we've moved from the stay-at-home order was lifted by the governor a week ago, Monday, and now we're in the purple tier. This is our hospitalizations and ICU visits. Obviously, this is one of the big concerns when we went into the stay-at-home order. The governor was looking at hospital capacity, ICU capacity. Fortunately, in Marin, we've done relatively well with that. Now we're back into the purple tier, which is defined by case rates and case positivity rates and not hospitalization capacity. Next, please. This is the California blueprint for a safer economy. Again, we're back into that four-tier system with the corresponding colors. Almost the entire state is in the purple tier. We in Marin, this is you can see our numbers there on the left, are 28.6 new cases per 100,000 residents compared to 71 at the state level, with a percent positivity in Marin about 4% compared to 12% at the state level. So we have less than half the case rates as the state average, less than half of the percent positivity, and about twice the testing rates as the rest of the state as well. So it's not attributable to decrease in testing. Next, please. And this is the tide is, I would say, looking at those slides in terms of our better incidence, decreasing percent positivity, combined with what we see here, which is increasing numbers of people being vaccinated each and every day, the tide is turning. The tide is turning on our experience of this pandemic. We obviously don't have nearly as much vaccine as we would want, and we are waiting eagerly for just the manufacturing to ramp up and the distribution to the states and the local jurisdictions. But this is what we've accomplished so far in Marin. 32,000 residents, more than 32,000 has been vaccinated, almost 11% of our population thus far. With the light blue is there, the first doses, and the dark blue is those that have received second doses. So we're just really trying to keep up now with all the second doses needed for those people that were vaccinated at least once. And it's looking like, unfortunately, just to set expectations, just got an emergency call with the state this morning. There really is no magic supply out there federally or at the state level. And we're looking at some really lean times in terms of the amount of doses we will have as a community for at least the next few weeks. And we all just have to manage those expectations. We in Marin don't have the ability to acquire vaccine directly ourselves. We are wholly reliant on the state allocation, and the state is wholly reliant on the federal allocation. And so we are using every dose we have as quickly as we can, and that's our promise to you. The reason we are focusing on our residents age 75 and greater is that we recognize that in that setting of extremely limited supply, our first goal is to save lives. And we have a very clear organizer around that because of the remarkable relationship between age and risk of mortality with COVID-19 infection. We know that based on Marin's numbers, a vaccine offered to someone age 75 or greater is 332 times more likely to prevent a death than one offered to someone age 50 or less. It's hard to look at those kinds of numbers without in the setting of very limited supply without choosing to prioritize that group first and foremost, at least until we can get through that age group. People above age 75 in Marin County, about 1 in 7 who are infected have passed away, about 15% mortality rate in that age group compared to well less than 1% mortality in people less than age 64. So that's the reason why we've chosen to vaccinate our oldest residents. From an equity standpoint, we also recognize that if we're choosing to vaccinate our oldest residents, we are representing all of our groups by race and ethnicity equally in Marin. On the left there, you see the breakdown by race and ethnicity among people who have died from COVID-19. And on the right, you look at that same breakdown of our population as a whole. And you can see that they match up almost exactly. And so we're recognizing that we are carrying a goal of equity into our vaccine distribution plan, also preventing deaths. And those goals align perfectly in our strategy currently, which is just covering everyone above age 75 in the community. I know there are questions about how that relates to the other groups that have brought online. This is the state's framework, vaccinate all 58. The state has said that we can prioritize age 75 and plus and workers, education, childcare, emergency services, and food and agriculture. In Marin County, we have about 10,000 people working in education, another couple thousand childcare. Then you add those other sectors, you probably have at least another 5,000 to 10,000 if you include all of the grocers, the restaurant industry. Unfortunately, if you add all those up together, it just so far, the number so far exceeds the supply of doses we have. We just learned we have 975 doses allocated to the county as a whole for second doses this coming week. So we've actually had to start canceling appointments, even for those above 75 and above, potentially. We're working to try and prevent that from happening in a conversation later today with some of our partners. But the point is that there's a significant mismatch right now between the sectors that have been indicated in the state's framework are eligible with the amount of vaccine we have. And so we are forced at a local level to choose a much more lean strategy that's really focusing on mortality itself. So we'll offer in advance an apology to our educators who we have valued and have indicated we would prioritize in the vaccine. We will move forward beyond age 75 as quickly as we can, as soon as the doses we receive allow that to occur. And we have vaccinated some in that group among our educators, those at highest risk, but really needed to course correct partway through, which is the way we've been handling our pandemic response all the way along. It is a sign of strength, flexibility, adaptiveness to be able to recognize when we do need to course correct, rather than a stubborn adherence to something that just isn't working. Our allocation reduced, and we did not see any sign of increased allocations, and therefore needed to have a leaner rationing strategy based on conditions outside of our control. So that's the explanation for that shift. And I'll just end with this. This is the view out of my window here where I'm sitting right now in the canal area at my office. Last week, when we were setting up our point of dispensing, our mass vaccination site here in the canal to meet the needs of this community that has been so hard hit by this pandemic. Now, where that is, there's a beautiful tent, and 400 people are able to come through this site to get vaccinated each day. But this was as this was being built by the Department of Public Works to come in and set up that mass vaccination site. It speaks for itself in terms of the hope and the promise that the vaccine is bringing us. Thanks, everyone. I'll hand it over to Dr. Santoro now, who probably doesn't need an explanation, but has been one of the key champions and assets for us as a community in every aspect of our response, including our schools. Thanks.
Thank you, Dr. Willis. And we're seeing a lot of rainbows, even though we're going through tough storms ahead with very limited vaccine supply. I've just been heartened across this entire journey together, but especially across the past weeks, for us to work together to vaccinate our most vulnerable populations. And that's where vaccinations have been happening out in the community at facilities that have been managing outbreaks since March, honestly, of last year. And so it's we have prioritized school staff. School is our top priority for regaining the functioning of our community. Schools are part of that critical fabric of our community, and vaccines are coming. We just need to continue to be patient. The good news on the other side of this is that we really are demonstrating our success in safely reopening schools, even moving through a holiday season where we saw the surges that Dr. Willis described. We still have less than 10 suspected school-based transmission at this point. We've been investigating our team. I get a lot of questions about this is only based on self-report. That's not the case. We investigate all cases, confirmed positive cases of COVID-19. We have a team of over 100 people who are contacting individuals, and we have prioritized two questions where it relates to schools. One, identifying all individuals under the age of 18 for priority contact investigation. And then two, one of our first questions we ask is where do people work? So we're not just dependent on staff or families reporting a positive case. We have a safety net in our laboratory reporting system. So the numbers that you then see underneath the 151 students and the 38 staff, these are individuals who have been identified that during their infectious period, so 2 days before a positive test or 2 days before they are symptomatic, and then for 10 days till they complete their isolation period, they've been identified as being in an in-person learning environment, which then we engage in a more detailed investigation. So just be rest assured that is not just depending on self-report. We are investigating all known positive cases that are required by state law. We need, as a county, we must receive all positive and negative results for COVID-19. And then this is our most updated slide that Dr. Willis alluded to, but I think it's something for us all to be proud together. We'll be approaching 1 million student days. And as a mother and as a physician, just so thankful for the efforts to have children in school. It is all of us working together, and those will be 1 million days where children have had just the positive school connectedness, having another caring adult in their lives, all of those protective factors that school offers beyond the education itself. So we're really proud of that. We also have not had any student to adult transmissions yet. Just as further details, the transmission patterns that we have seen in those 9 cases. And then I'm gonna pause for a second and let Mary Jane speak to the rest of the slide, just around how many schools are open. They're not all open the same. We're different districts, but I just love for Mary Jane to.
So we can see that 42 of our 43 elementary schools are open. There's one public school that's not yet open, but cannot wait to open as soon as we get into the red tier for 5 days. 27 of 28 of our K-8s, one middle school not yet open as well, planning to open in March. 5 of our 17 high schools. So just to note that our high schools had most had intended to open on January 6th by way of example, but because we found ourselves in the purple/deep purple tier, that they have been waiting now until Marin County moves out of the purple tier into the red tier. And that's not a decision that's being made locally at the school level. That's a state requirement. And so they're unable to open until that happens. And so Dr. Santora, do you have a note about when do you think we'll move into the red tier?
We have the crystal ball. We believe we'll move into the red tier before the end of February. As Dr. Willis described, it was a steep decline. I haven't gotten a clue yet on the numbers. I don't think it's going to be this week. Dr. Willis?
Yeah, I mean, it's up to us. You know, there's a concerning little plateau. So we had a really steep decline from January 10th through about the 25th. And then the last few days, we've had a kind of a plateauing at around 20 cases unadjusted. So 5 days ago, I would have answered that differently. Hopefully that's just a little blip and we'll continue to decline and be in the red tier. We got to be in red tier numbers for at least a week before we can actually enter in terms of our policies. So our goal would be, our hope is that Lisa's right, before the end of February.
And our biggest concern right now, honestly, is the Super Bowl. We know the exact behaviors that drove up our case rates in the holidays, and that's indoor gatherings. At this point, there's no permitted, we're in tier 1 purple, there's no, and I'll say this a couple times throughout the presentation today, there's no mixed household gatherings allowed indoors. We know that is in direct conflict with people's expected behaviors during the Super Bowl. that brings households together, but that based on the patterns that we saw throughout the holidays, we would expect to see us jumping up in cases 7 to 14 days after Super Bowl weekend. So it really does depend on us keeping it small, sticking with our own households and not inviting other households over. It is a consistent pattern is once we have those events that bring together households indoors, we will see an increase in infections. So you can look to technology to have Zoom supported Super Bowl watching. I'm jumping ahead. Doesn't want me to jump. Oh. And this is the other question that we've been getting a lot is just around secondary school data. When we were showing this data, many people weren't seeing it was just primary schools. We have secondary schools that have been in attendance throughout the county. And also there's been no suspected cases of school-based transmission in our secondary schools yet. That's probably driven by just there are less students that are attending secondary schools, but also the behaviors that in that primary school level, we know kids are still learning their protective personal behaviors like hand hygiene and face covering. And we're seeing our adolescent and teens doing a great job when they're on school campus of following personal protective behaviors. And this is just a research update. I'm not going to go through it point by point, but there really is a growing body of evidence that schools are not contributing to community transmission. That was the reason what moved us on March 13th to move forward with the closure of schools, thinking that COVID could behave similar to the flu, where children are primary drivers of flu, for example. We have not seen this with COVID-19. And now we're starting to see much more published research and literature around the safety of school reopenings, not only in our country, but across the world. So we've updated our decision tree. The most important thing is we've updated the symptoms. Again, this is really based on evolving research that have identified how are children and adolescents presenting with COVID-19. Most present with very, very mild disease, if not asymptomatic. And the key symptoms that we're seeing are cough, shortness of breath, that loss of taste or smell, fever, sore throat, diarrhea. Those are the key symptoms that would require, if your child or student has any of these symptoms, they need to get tested for COVID-19 before going to school. They shouldn't return to school without a fever for more than 24 hours without fever reducing medicine, and all of their symptoms should be improving. Just to note that school nurses may require testing, even if it's other symptoms like headache or runny nose, if the school nurse suspects that there may have been exposure or another reason to request testing for COVID-19 prior to return to school. And just to reinforce, again, we are still in tier 1 purple. There can be gatherings of no more than 3 households. All gatherings that are allowed must be outdoors at this time, means no sleepovers. That was one of my inbox questions today. So sleepovers aren't allowed at this time. No indoor play dates. Send your kids back outside on their bikes or walking with their mask. But outdoor play dates are allowed, but again, keeping it to the 3 households. The other change has been around travel. Where the recommendations from the state are for travel for 10 days after out-of-state travel. So no longer in-state travel, even though the state guidance around travel is still to limit your travel to less than 120 miles from your home county. That being said, it's really how you travel. Again, your biggest risk is if you travel with other households. This is actually a pretty common phenomenon that we saw across the holidays, is when people mixed households and they traveled with other households, renting a house together or going and staying at someone's house. That's when we saw COVID-19 transmission. So it really is, again, those household gatherings that are driving transmission in our community, statewide and across the country. So this is just an update. Again, I'm not going to say much. These are our documents. You can go on our websites and find all of these documents, just reinforcing that there should be no indoor household mixing at this point. And then if you are going to have indoor, that would be considered a high risk activity. And we would recommend, if you do mix with other households indoors, let's say you do have a Super Bowl party, you should get tested, you should quarantine. And so not go to school, not send your child to school after a Super Bowl party, and then get tested 5 days after that high risk activity. And when we'll share these will just have the links to all of the state advisories that are in place as of this point. So again, this is just reinforcing the language around, I know there's, especially moving into the reopening of secondary schools, of our middle and high schools, there's concerns around cohorts. We really are looking at stable groups. And what we've seen with our middle schools and high schools that have been in attendance to date is that what our team needs to ensure that if there is a case of COVID-19 on campus is that we have good attendance records. And that's what we drive from, is those attendance records to see who may have been a close contact. So that is the primary driver of infection. It's those close contacts. It's not what we're moving forward as we are reopening middle schools and high schools is really using the definition of a close contact. So just not closing an entire grade level or an entire classroom because of a positive case, but working with the teacher and student to identify who may have been their true close contacts. There really shouldn't be any close contacts in most of our school environments because we're maximizing physical distancing. People shouldn't be less than 6 feet for more than 15 minutes. The exception to that is that there are schools that are returning to having their desk more than 4 feet apart, as we are, again, moving towards the return of full in-person instruction. And you'll be seeing a shift in our approach towards contact tracing. And what we're seeing, what's driving this is the burden and the benefit of closing cohorts or closing classrooms. We're not seeing a decrease in transmission. So we're seeing that we're excluding children and students unnecessarily from classroom because there really aren't close contacts that are driving that infection. So that's going to be updated guidance that we see as we move forward. And that's aligned with the updated state guidance around contact investigation at the school level, where there is not a recommendation from the state for closing a classroom. It really is looking at those close contacts that a student or staff may have had. And so if you do look at the new schools, the school plan from the state, they are showing that they are recommending a new cadence. They're calling a cadence around testing that's based on the potential prevalence. We right now are recommending testing after high risk activities. We're recommending surveillance testing of asymptomatic staff, and we're recommending testing of symptomatic and exposed individuals. So we're not universally recommending the asymptomatic testing of students at this time. We'll be looking at research and data that is emerging on this front, but there is not research that's showing the overall effectiveness of asymptomatic screening of students. That being said, we'll be looking at the research to see if we need to update our guidance on this front. The key, again, is those core mitigation strategies. Before I jump, we have had a universal precautions approach. We assume every person is walking onto that campus with COVID-19, which is why we have implemented from before meetings like today, where we're educating families around measures to reduce their risk of transmission. We are working on making sure families are screening and getting tested if they've had a known exposure or high risk activity, really creating every barrier possible of the entry of COVID-19 onto that school campus. There's one child who's not on the school campus today. And so that's, again, that universal precautions approach is critical, and we've demonstrated, Marin, that it's effective at reducing and preventing school-based transmission. Mutations, I know you're seeing a lot about mutations. It's in the news. The mutations that have been recently published in the Bay Area, we've known it has existed since the fall of 2020. What we've seen as being the primary driver of increased cases, again, it goes back to the behaviors and the gatherings. We're not seeing these potential increased infectivity by these variants result in a surge of school-based transmission or outbreaks or clusters. This is what these viruses do. They do mutate. They mutate actually not as fast as flu or HIV. And again, this is what viruses do. That being said, we are following very closely and determining if we need to make any updates in our guidance or recommendations if we do see variant activity increase COVID-19 transmission in the school environment. So again, just this is reinforcing what I said earlier. We really have a universal precautions approach. Assume everyone has COVID-19. We will be updating our 30-point guidance for alignment with the new state guidance, but there are no major changes. If you looked at the state guidance, it very much aligned with Marin County's approach towards safely reopening school. And again, these are just some of those, we really see the school site specific protection plan as that key tool that starts with families, and then it goes also to the behaviors of students and staff on campus to make sure we create the safest possible environment. The significant update that came at the state level is also the alignment with Cal OSHA. And so you should be, if you look at your school websites today was a deadline for posting their safety plans. Again, there were not major changes that needed to be made. It's just some alignment with Cal OSHA reporting and Cal OSHA requirements. Mary Jane, anything you want to add around this part of the COVID-19 safety plan?
No, I don't think so, except that the districts are definitely, obviously, are working on this. And there's some question at the state whether this February 1st deadline is actually one that will be holding to, we will be held to, but we have provided information to the districts to put together their packet. And the bottom line is it includes their school site specific plan, which they all already have, along with a Cal OSHA checklist, which matches directly with the school site specific plan, and the need to include their collectively bargained agreements in the case of schools that would have those. Some of our independent private schools might not. So it's just putting it all into one place so it's available to the public.
So again, I'm just closing. We are not seeing schools as a driver of community transmission. They provide stable, structured, supervised, and most importantly now supportive environments. We are really concerned just about the emotional and mental health and well-being of our students. And school, again, provides the connectedness and other caring adults that our children and adolescents need after having many months of a very atypical school year. We strive to be transparent in our data and have these public meetings and convenings where we can answer questions and provide updates. And again, I'm so thankful to both our schools teams across the districts, especially the public health liaisons who are school staff from your schools who attend weekly trainings and are all earning their master in public health. I wish I could provide them a certificate, and who are just fully committed to creating the safest possible environment and bringing the best tools to our community to keep our schools and our school staff and children safe. So we have a goal. Our goal is to open all schools in Marin County at all grade levels. Our goal is to continue to implement these school site specific protection plans. We know it's keeping our students and staff safe. We are committed to vaccinating all child care and school workers. Again, we're working with very limited vaccine supply, but it is our commitment. Just like you hear the tone nationwide, we've been committed since the beginning of to reopening school and see vaccinating our school staff as a key tool in achieving that. And our goal is to get everyone back for full-time in-person instruction before the end of this year. And even if it is only for a few weeks, our children will benefit, our children and students will benefit from that regular time. So I'm really looking forward to moving in that direction. And I just want to make a comment. I saw it on one of the other meetings where I posted this photo of a kindergarten teacher meeting her kindergarten student on one of the first days back at school. And it was commented that it wasn't, they weren't 6 feet apart. And so I think if you can just imagine, it made me think of when we first were living with HIV and AIDS, is that there are times when it is appropriate to hug a child and to be less than 6 feet apart. This is not a COVID interaction that you're seeing. Everyone's wearing their mask, and we want to minimize that time. We don't want to be sitting next to each other and face to face for more than 15 minutes, but especially with our youngest students, having touch and being close is critically important to their social and emotional development. So no one did anything wrong in this picture. It was meeting their teacher for the first time as a 5-year-old. And I remember that first day of school myself, and to have this environment is so challenging for, again, just the emotional health of our kids. And I'm just so thankful for instructors and teachers and school staff that made this day possible and are making almost 1 million days possible for us and for our kids. And so these are the last questions. You want to run through them with me,
Sure.
Mary Jane?
Sure. Can you provide an update on vaccination for school staff? We're a priority and will happen as soon as you get through as many of the 75 and over as you can. But just for everybody to know, we're working very closely with Dr. Willis and Dr. Santora. As you may be aware, we were able to vaccinate over 1,000 people in a single day. We just need 5 more of those days or evenings or whatever. So as soon as the supply is ready, we are so ready to continue to move forward. My personal goal was that everybody would have had their first vaccination, every educator, by February 23rd. Now I want everyone to have their first and second prior to the April break, which is April 4th. So that's the goal that we're holding. And just so you know, we stand ready to go. We want it to happen. It will depend on supply, and then obviously supporting those in the 75 and older range. For you to know that we have over 200 people from our schools, public, private, independent, parochial, who have raised their hands to support the clinics that are vaccination settings that are in play right now. And this weekend, by way of example, several people were there to help support the 75 and older. So we're doing our part, and we can't wait, Lisa, to get back in there.
And we will have second dose. People will get their second dose. Right now, we are on target to get people their second dose within that 21 to 28 day range based on which vaccine you received. But we just can't overstate their very limited vaccine resources. And so there may be changes in policy around allowing more time between that first and second dose, which is already allowed by the CDC, but not yet approved by the state. But vaccine supply is our biggest issue right now.
And can I echo Mary Jane's statement about the volunteers? I mean, this is a big operation. You know, getting everyone. We have 260,000 residents. We're going to have to do over 500,000 vaccines over the next few months. This is all hands on deck, and MCOE, and in relationship with the school, step forward to help volunteer not only the day where we are vaccinating our educators, but on other days at these vaccine events. And that you can imagine now with people age 75 and older, some may need a little more help than others in terms of just working through the flow of registration. And we recognized we needed more help. We needed more helpers on site, and we're able to do a quick call out to MCOE, and it just took a phone call. And everyone on our team recognizes that if you're looking for high quality volunteers that have the emotional intelligence and the aptitude to just help manage people in that situation, stressful for some, you go to schools because you guys know how to do that as part of your everyday work. So thank you.
You're welcome. The next question here is, why would a resource specialist working with students in person in multiple classrooms be excluded from the priority 1 school staff vaccination list? Each of the schools in our county set their priority list, and I would just want to say that where we are right now is the next group will be everybody who's in person, in priority 2. So we're almost there. Lisa, I think you already got to the cadence for testing. You've already reviewed that, and I think you already answered the updates on travel restrictions. Don't go out of state, and don't mix with more than 3 other families, or you'll be involved in high-risk behavior. A couple of other questions that came forward: why is cheerleading in the yellow tier? Anybody have any thoughts on that?
No, I think the state's tried. I mean, basically it's based on risk. So the state is trying their best to look at the sports act. We know sports are really important. Look at sports activity from contact sports to non-contact sports, and align what is allowable based on the interactions and the risks. So with some cheerleading, there's close interactions and tossing and things that I can't imagine my body doing, but that could increase risk of, again, that physical proximity, especially with the nature of close, the practice that's required to achieve some of these high advanced skills. And so we're committed to following the state as it moves forward with its guidance around competitive sports and allowing practices. And again, the sooner we all follow the orders, the closer we get back to orange, and then we'll be engaged in those allowable activities.
How much leeway is there? That Moderna 28 days, right? Pfizer 21 days. Does it have to be exactly on the 21st day when I get my shot, number one? And number two, if I got a Pfizer shot, is it okay if I get a Moderna shot the second time?
So we are striving right now based on state guidance to stick with the, it's a 4-day before and after grace period between the Moderna, which is a 28-day, so between 24 and 32 days, and Pfizer, which would be between 17 and 25 days for that second dose vaccine. It is allowable at CDC up to 6 weeks. So if you're late on getting your second dose, don't stress. We know vaccine creates a lot of stress for people too, making sure they get their appointment on time. But you'll still have the protective benefits if you have time, greater time than the 28 to 32 days. But right now we're on target. That could change with vaccine supply.
Yeah, just want to echo, that the CDC is really officially allowed an elongation of that second dose. You get a lot of bang for your buck on the first dose. And then, the full protection is about 10 days after the second dose. But depending on, your immune system and whether it's Pfizer or Moderna, 80%-ish protection just with the first dose, which is better than a lot of vaccines. Even, like flu vaccine is lower than that. So lots of benefit with the first dose. Right now, we're still on schedule for the second dose, but that might get prolonged as we see the decreased supplies, and the CDC has already authorized up to 6 weeks before your second dose. We haven't taken that step yet, but I imagine the writing is on the wall for us to probably begin to implementing that practice in the next couple of weeks if we don't get more supply.
And you can't mix doses. You can't mix your Pfizer and Moderna. If you got Pfizer, you get Pfizer. If you get Moderna, you get Moderna.
Are you doing anything to deal with the structure around buses? So right now there's certain structure of how many students on a large bus for some of our districts. In order to get more kids into school, they're going to need a little more flexibility.
Yeah, we're looking at practices from transit authorities across the nation on best practices. The upside with school buses is they all have windows and they don't have the longest runs. So again, safety is our top priority, and reducing COVID-19 transmission risk is the second to that priority. But we also recognize that their transportation is a key part of getting students to school. So we'll be reviewing our guidance where it relates to transportation and how many students are allowed on a school bus, and then what are the conditions, for example, all windows down, that would create the safest possible environment for transporting children to schools.
Mm-hmm. When do you see students getting vaccinated?
That's going to be a long time.
Mm-hmm.
Yeah, they're not part of the studies. So right now, the phase 3 clinical trials that have validated the safety and efficacy of the vaccine did not include children categorically. Those studies are in the process. So we would need to wait until those studies are performed, the results are completed, we understand how it behaves with the immune system of a child. So that'll be the last cohort, probably summertime. The good news is that if we're successful in reaching everyone else in the adult community, age 16 above are part of the studies, that, by that point, if we have 80-90% coverage in the rest of the community, our children, just by virtue of herd immunity, will be well protected by that point.
Lisa, this is to a comment you made. Did I understand correctly that you are recommending moving away from closing cohorts if someone is positive across the board? Or is that specific to high school?
We're going to be looking at all grade levels for looking at that guidance. We're not seeing transmission patterns. So we've closed, hundreds of classrooms have been closed across this since schools have reopened, and closed for upwards of 10 days, 10 school days. And again, the harm of excluding when there's not a high risk of transmission is something we're evaluating. So we'll be updating that guidance. We're anticipating it would be different for the TK through 2 levels, just due to the behaviors and managing student behaviors in the under 3rd grade population. And that's what aligns with the state guidance. The state did not recommend classroom closures for positive cases. The state recommended only the exclusion of known close contacts and identifying close contacts. So this is a shift, and this is something I've said probably since the spring in June, is that we always err on the side of caution, taking very conservative approaches, especially since we were leading the state and the nation in reopening. And now we have the evidence and data to show that as we can pull back on some of our strategies, and again, with the focus on preventing COVID-19 transmission in the school and optimizing that learning environment. So we anticipate an update within the next week or so on that.
And Lisa, that would apply to special ed classes, right? Where kids are close together.
Special ed would be considered in the TK through 2 group, where not different grade levels, but the risk would be the same, especially with their different behaviors around face coverings, et cetera.
Okay. What about the recent suggestion about wearing 2 masks?
The CDC recommends you wear a 2-ply face covering or cloth face covering. What we see when people wear 2 masks is then they're fidgeting and touching their face. So I think the first step is get a mask, a face covering that is well fitted to you, so you're not fidgeting. 2, if it's a mask, make sure it follows CDC guidance, and that's where we're directing everyone is back to the CDC guidance. That is, if it's a cloth face cover, that it's 2-ply, 2 layers of cloth that should be in that mask, but not double masking at this point. And there is no research study published on the effectiveness of double masking. When we've worked in the outbreak environments, for example, in our nursing homes, there was a time people were wearing a surgical mask over an N95, and that's because we had limited N95 masks and we didn't want them to get dirty. But the concern from the state when they came on site is, again, that the touching and manipulation of masks, then you're potentially touching your own infected respiratory droplets and then not washing your hands. So potentially increased risk. So get one good face cover that fits you best and make sure it's 2-ply, and just look at that CDC website.
Okay, can you talk a little more about the issue of the variants? There's quite a few questions, concerns, data that the variants are more dangerous, etc. So can you just speak a little more about that?
Do you want to nerd out first, Dr. Willis, on variants?
Yeah, obviously the variants are, obviously a huge concern globally. We understand why variants occur, in every individual that's infected, it's millions or even billions of virus particles. And probabilistically, just if there's one error made as it's reproduced, that becomes a little bit of a mutation. So you're seeing, the fact that these viruses mutate is known. And when you have, millions of people across the globe infected, just from a probabilistic standpoint, you're going to see this. So it's really a race between our control measures, the vaccine and the mutations. Right now, we have at least 3 real, variants. Most of those variants don't cause any real significant changes. Those mutations. Occasionally, there'll be a mutation that actually confers real benefit, like survival benefit, fitness benefit for the virus. Either it makes it more infectious or it might make it more virulent. Things to be concerned about. And right now, there's a few strains that seem to be characterized by at least increased infectivity based on changes in part of the virus called the spike protein. There's been a strain, a California strain. There's the UK strain. There's a strain in South Africa that is concerning because it may not actually be as well covered by the vaccine. Those are primarily characterized by increased infectivity. So we're not seeing a lot of evidence that they make you sicker or more likely to die. Unclear, probably not a lot of change in the virulence. But there does seem to be significant increase of transmission. As that relates to the schools, I think there's a couple points. One is, I've heard, well, then why are you reopening? Why would you not just shut everything down if you got these variants? The other is the reality that if this is the way the virus behaves, how do we think of the post-COVID-19 world? I mean, is there going to be a post-COVID-19? How long will this last? And I think, to me, that point of it may be a while before we have an environment where we can just say COVID-19 is behind us. So we're going to have to learn to live with an environment with COVID-19. And so the work that we've done to prepare our schools, all of these variants have in common that it's a respiratory virus. It's transmitted through the ways we already know. and the practices that we put in place in our schools and across the community in terms of physical distancing, facial covering, all those standards are ultimately what will protect us against any variant of this. And so I don't see that it changes our strategy in terms of protection. It means that we need to be on our A game in terms of all the things that we have been doing when we're doing our best. The concern about the vaccine coverage, fortunately, the mRNA vaccines are, there's the technologies that are easily modifiable to match changes in the strain. So if the spike protein changes a little bit, makes it a little more infectious, you can just change that a couple codes on that mRNA vaccine, do that in the laboratory, manufacture a new vaccine that matches that strain and distribute it as sort of a booster. So that's, could be the way this works, and then over the next coming months or even years, where there's these boosters that are being offered that match the emerging strains or the variants the way we do influenza. But again, it also means, just stepping back, that we ultimately have to find a way to live in a world where COVID-19 is part of our environment. And all the work we've done in Marin County to prepare our schools to be as safe as they can is going to stand us well as those that we've served as a model through outside of our county.
Okay, there's a question about, and I'm not sure about the data here, but just to ask you, that over the last 7 days that there have been reported 345 new cases of COVID in the Canal area. Do you know if that's accurate?
We would have to confirm, but it doesn't seem like a far off number.
Okay, and so then what is the implication for the schools, San Rafael schools reopening? And maybe you could talk about the vaccinations you're doing in the area now.
Well, I think one is going back to, we have a universal precautions approach where you assume everyone has COVID-19. And so I've been on site at Bahia Vista and all this, and many school campuses in the San Rafael School District, and really been impressed with the measures of physical distancing, supervision, and optimizing all of those mitigation strategies or control measures. So even if someone is infected with COVID-19, they're not going to transmit it to someone while they're on the school campus. Two, the picture Dr. Willis showed you earlier shows our commitment to equity, making sure the second pod or point of dispensing site we stood up was in the canal. And we're working in partnership with our canal outbreak prevention and response team to make sure that the canal community is ready, that they have all the information they need to make an informed decision around getting vaccinated. And by positioning that clinic in the canal, we'll be able to vaccinate one of our hardest impacted communities. And again, we closely follow all of our data, and what we're consistently demonstrating with almost 1 million school days, we've had less than 10 suspected school-based transmission. And I just think that's what we can rely upon, is that effectiveness of those school site-specific protection plans. And again, of the engagement of families beforehand, really minimizing the risk that they're engaging in, and then getting tested. And we do have testing widely available in the canal. So people are getting tested. And I think it just shows the commitment of our community as a whole to, to get tested, to make sure that they're safe, and to create the safest possible environments.
Can I add something to that? Because I mean, in my inbox and even conversations with friends, I have obviously a lot of physician friends, and even the physician community is, some of our strongest champions towards opening schools are physicians, and some of those that are most concerned about opening schools are also physicians. And we recognize that there's a diversity of opinions that really leads to the best final choice. And for our part, we have been very strongly supportive of reopening schools for all of the social, mental health benefits and the confidence we can do it safely. It is not a hell-bent approach. It is responsive to the data and the reality as it emerges each and every day. And so there are criteria for closing schools that relate to transmission at the school site. I mean, if we're seeing outbreaks in a given school environment, there are criteria for that school to close to allow that to pass and then reopen. And so again, it is not a no matter what strategy. It is a when possible and when safe strategy. And that's how we're able to continue to move forward, just looking at the most important data available to us, which is the incidence of transmission as occurs in the school community.
Okay, could you please review the 120-mile travel restriction again? Again is capitalized. For the 100th time, our families are asking for further clarification. Re Tahoe.
By the way the bird flies, I believe Tahoe is less than 120 miles, but it's more than 120 miles by driving. So again, it's how you're traveling that is your biggest risk. If you're going to Tahoe with another family, you're engaging in a high risk activity, you should quarantine upon return from your trip to Tahoe. If you're going to Tahoe with your own family, your own household, and you're staying in another household, you're staying with your own household, not with another household. You would not be required to quarantine. That's different than what we had under the stay-at-home orders, and that's the change. But it's still not. It's the state's guidance is that you consider you're traveling outside of the 120, no more than 220 miles from your home base. But it's really more about how you're traveling. So you do not need to quarantine if you return from travel if you do not go with another household and spend time indoors with another household. But if you go out of state, if you go to Nevada, that's a different state. So if you go to Nevada side of Tahoe, that's out of state travel.
So watch where you ski at Heavenly. What about the issue? Will second doses be honored? If I had my first dose and I'm scheduled for a second dose, can I anticipate that you're going to go ahead and allow those to continue?
For now,
Yes.
yes, unless we have vaccine supply that affects that. And then when you would be prioritized, the worst case scenario is the worst case scenario someone would be experienced. They've got their first dose already. They have an appointment for their second dose and we don't have supply. That's not how we're scheduling. We're scheduling our appointments based on supply. But you would be, if the worst case scenario happened where you had an appointment and you cancel your appointment, we would prioritize you to get that second dose within the 6 weeks. And so we're updating our inventory management systems to really align with information we're getting from the state to avoid that stressful situation where someone has an appointment and couldn't get access to their vaccine. The second dose is something our top priority is making sure that if you've had your first dose, you get your second dose.
Mm-hmm. If there has been a case of COVID positive staff or student in a private independent school or parochial school, would they be included in the numbers you're providing?
Yes.
So is it for sure that we won't move into the red tomorrow?
Yeah, I don't think we're going to red tomorrow.
Okay, that's a disappointment. All right, Lisa, this is sort of, I think, good to review what your public health liaisons are doing. When a transmission at a school does happen, though very rare, are the schools provided with details on what may have occurred so it can be mitigated, issues can be mitigated going forward?
Yeah, so our public health nurses speak to the public health liaisons and try to identify what were the conditions that might have led to the suspected school-based transmission, and to provide guidance back to the schools to address it. With many of the cases that we've had of the 10, there's been a few times where there was very specific guidance that we provided. There was a lot of COVID that was circulating in the community. So some of the suspected COVID-19 transmissions might not have truly been school-based transmissions. It's just that there were students that were tested in the same classroom who tested positive at that time period. So we called it, we called it school-based transmission, but sometimes the stories don't all add up. So we'll err on calling it a school-based transmission if there's any possibility of a school-based transmission. And we'll try to identify any areas for improvement in a school site specific protection plan if we identify those. So there's a lot of communication and contact between our public health department and our public health liaisons. And then the other thing we hear about is around communication, where we do send out scenario letters. They're called scenario letters, depending on the specific scenario of a known exposure or possible exposure to families, so they can make informed decisions, be informed of what's happening on campus. We've heard concern though when sometimes some schools are just sending it not to the entire campus, they're sending it to the classroom specifically. We hear some families frustrated that they're not notified, but again, it's because we're notifying based on risk, just like we would with strep or flu. The entire school campus doesn't need to know every time there's a positive case, because it's not going to change the risk. Everyone should be engaging in those personal protective behaviors that prevent risk, and then we will make those notifications based on possible exposures, depending on who's had a potential exposure.
I'm seeing more, Mary Jane, I'm seeing more questions regarding the red tier. So we have to have a adjusted case rate less than 7 to go from purple into red. And right now our unadjusted case rate is just above 20. We might cut it in half with the adjustment based on testing. Still that length, we're well above that 7 that's required. So tomorrow is not a realistic date for moving into red.
What about February 9th?
Possible, but the biggest risk is we could bump back. Again, that's where we've seen this, where we could go in, and then again, because of behaviors for Super Bowl, we could see one, we could have a limited time in red. So I think really just focusing on the personal protective behaviors. So once we get to red, we stay in red.
And before we could move into red policies with regards to schools, we have to have red tier numbers for an interval of time. And I think is it 14 days?
Now 5.
Now it's 5 days. Okay, it keeps it. So right. So at least we'll know. So the first thing you'll know is that our numbers are now red tier numbers, and we'll make that clear. And then the clock starts. And if we keep those numbers for 5 days, then we're actually able to move into red tier policies. So you're going to have advance notice regardless. But we're not even into the red numbers yet.
Okay. So with that positivity note from Dr. Willis, first of all, thank you very, very much. To remind everybody, this session, we'll have another conversation like this on March 1st, a month from now. If for some reason Public Health would like to have us get together more frequently or sooner than that, we'll go ahead and set another session. Thanks to everybody on the call. Thank you, Dr. Willis. Thanks, Dr. Santora, for everything. A special thanks to all of our staff, the 72% who are teaching in person. And as by these questions, you can see how many people can't wait to get in the red tier so they can get their schools open. So we're very much looking forward to it, and looking forward to when we have the opportunity to get more of our staff vaccinated. So with that, thank you very much.